Now, a big portion of toxicity and what we're seeing a lot, I feel like in, neurological conditions, and what you hear a lot about is heavy metals. Mm-hmm. And a lot of people are a little bit on the fence as how much of a cause heavy metals in our environment or that we're consuming can lead to certain conditions and certain issues. But what are your thoughts in general on the prevalence of heavy metals and how that relates to neurological conditions?
Yeah, so I rarely, as we just talked about, see someone with one thing, like with just mercury toxicity. And especially years ago, I've been doing this about 20 years. I did often see, thyroiditis or hormone imbalance or a little bit of extra mercury. It was much more simple. And now it is never simple. It's always layered and it's always multiple things. So metals are usually part of the picture. I rarely see them alone. And they do add to the load. But once again, if you think about what we first talked about with mold trashes the detox system. So often metals, the same as the infections, it looks like someone's incredibly toxic, and it could be chemicals or metals if they're in a moldy environment, because their detox is just trashed. It's tanked. There's no glutathione. But again, if I get them detox, sometimes it's not as big of a deal, or they can actually, because we forget our bodies are kind of created or made or, designed to detoxify. So we are a detox machine. And if we are given the right circumstances, the right fuel, the right air, water, food that's clean, we can actually handle quite a toxic load and do fine. So it's not something to be afraid of. But because the load, it overloads our system, the bucket gets full and spills over the top. And because of that, if we decrease that load, then we say, what's left? What else is here? If, though, there's someone who still has metals, it is an issue. You do need detox. I start with the gut. I do a lot of zeolite and binders through the gut and do, like lipoic acid, N-acetylcysteine, glutathione, and then make sure we're repleting minerals. I do a little bit of DMSA. I don't use a lot of EDTA because I find I have a few colleagues that are experts in that. And if you don't know what you're doing with the IV chelation, you can mobilize something that's not excreted and get someone worse. So I'm incredibly respectful for that. It's a great therapy for the right person. And I leave that to someone who that's all they do and they're really good at it. And I'm sure with your clinics and stuff, not against it at all, but I'm that's not my expertise, but I know when it works and I know when to refer people. And for lead, especially EDTA and heart disease, there's a lot of data and it can be incredibly effective. For mercury, I find oral DMSA or oral zeolite can be just as effective.
Yeah, you're absolutely correct. That, chelation is not just chelation. It's not just you just jump in and do 20, EDTA IVs and that's it. Depending on who it is, it could be absolutely detrimental. And you could start to move things that are in connective tissue and start to deposit in the brain, even a heart or elsewhere. And that's where it gets really tricky. And you do have to be skilled. And that's where quality comes in over quantity and knowing what you're doing. So I'm glad you brought that up. Now, mercury amalgams, is that something you take case by case, or are you asking your patients to remove them at the right time in all cases?
Gosh, it's all these things are expensive, right? So I'm always checking where are you at, what you afford. This area, whether it's cavitations or root canals that have failed or they're leaking into the, and we talk about lipopolysaccharides and endotoxemia, which is the dumping of the gut contents into the bloodstream and a huge trigger for diabetes and heart disease and obesity and all that. It's called LPS endotoxemia. That can happen in your mouth as well. So you can have this leakage of bacteria into the bloodstream, which causes a massive, it may be, in my mind, one of the most potent immune triggers of all, the lipopolysaccharide, the LPS, and it can happen in the mouth. So you mentioned mercury, but I got a little bit bigger than just mercury, because what I see maybe more often than just mercury is old cavitations, like where your wisdom teeth and you have a little pocket of bacteria that's just sitting there for years, or root canals. Root canals are not all bad, but if you have a weak immune system and you're dripping bacteria because there's no way to perfectly sterilize a tooth, then for those people, they don't do well, and they tend to do better if they have those root canals pulled. I'll tell you a quick story on that. This was between the cancer, the Crohn's, and the mold, and I was doing fine, but I had a little psoriasis on my scalp and my body, and I went to a biological dentist, and I had 2 root canals, same meridian, and I learned that those 2 meridians were breast, pancreas, and colon. So breast cancer, Crohn's is in your colon, and the pancreas, I didn't tell you this, but I had pancreatic insufficiency after the mold, and I have had for a while. So that was literally my health history in the teeth. And I was like, okay, let's pull those. Like once I saw the meridians, and when I talk about meridians, if you're not familiar with that, the acupuncture meridians, go through all of our organs, and I am not the expert there either, but I know this stuff is valid. And when I saw that alignment with those, and it was the same tooth on each side, and when I got my teeth pulled, Casper, 1 week later, the psoriasis was gone, and I've never had it since. So there was something there that was clearly like, I was like, wow, I would have never thought pulling these teeth would have an effect on my autoimmune psoriasis. And it was mild, but it went away, like gone.
Yeah. Yeah.
So,
It's incredibly important what happens to your mouth. And a lot of times dentistry, not to blame them, because I think you're taught this a lot, is you see it as separate, head up. They say just go in the mouth, and it's, but when you talk about those meridians, those are real things. I've talked to many doctors about and have seen the charts of what is connected to what. And it is very true. I don't know if you ever saw the documentary Root Cause, but there's a lot of people there that talk about breast cancer, root canal in the one, and seeing a huge correlation, not just, causative, but that's fascinating that you experienced that again.